Well, hello everyone, and welcome back to Healthy Perspectives. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health, and I'm really glad that you're tuning in today. We've got a great episode lined up, one that's all about bringing healthcare right into the heart of our communities. And I'm talking today about school-based health centers. Now, school-based health centers are not new. But in recent years, Ohio has really leaned in and is investing much more and really expanding access to health care through these centers. And the impact has been incredible. Joining me today is someone who knows this space very well, Dr. Vanessa Meier. She's a family physician at MetroHealth Beechwood Health Center and also leads MetroHealth's school health program. She sees patients at the Wellness Center inside Cleveland Heights University Heights High School. Dr. Meier, welcome. Great to have you here.
Oh, thank you so much for having me. This is one of my favorite topics, so I'm excited to be here.
Well, let's get started with a little bit of background. MetroHealth's school health program kicked off actually in 2013 and is now part of the Institute for Hope, working closely with local schools to make healthcare more accessible. Now, Dr. Meier, you've been with MetroHealth since 2015. Can you share a little bit about your journey, how you got involved in school-based health, and what keeps you feeling passionate about it?
Well, thanks. Yeah. So as you said, I'm a family medicine physician. So I I went to Case Medical School and I did a residency in family medicine. And when I was doing my residency, I was able to do a program where I could get my master's in public health. So when I graduated from residency, I was a family doc, but I also had this background in public health. And I am very interested in how healthcare and public health systems kind of work together to care for our whole community. And when Chrissy Alexander, who launched our school health program at Metro, called me up and said, hey, we've got this job for a medical director overseeing our school-based health centers, I really jumped at the chance. School-based health centers, as you mentioned, have been a wonderful way for our healthcare systems and our public health systems and our educational systems to work all together to make sure we're all meeting the needs of our community. And so it's been such a joy to be a family doc and caring for my patients, but also to have the experience of being a doctor in my own high school. We
Now,
were able.
you got to tell me more about that because, what's it like when the students come in to see the doctor and, discover, oh, their doctor went to this school?
It is just so wonderful, right? I mean, what a wonderful connection and to have been, raised in that community and giving back to that community in that way. It really is a dream come true to be able to, serve in that role. And it's a wonderful connection for kids. One of the things that we hope is that every school health program provides that safe and comfortable space for our students to just come on in just as themselves and really feel comfortable receiving their healthcare in that way. And I really see that. I see teens and I see kids in my own clinic, but when they come in to the school clinics, it really is a different space. We really make sure they feel very comfortable in that space. And I think they generally feel comfortable in that space. It's the space they know, the space they feel comfortable in their schools. And I think it really helps us provide that kind of care for them in a space where they feel so comfortable.
Yeah. No, I think that's true, and I've heard that over and over. Let me just take a minute to step back and explain for our audience what we mean by school-based health centers. And what they are is, I think, pretty well described by that term, school-based health centers. These are actually medical clinics that are located inside of Ohio schools. They, of course, serve students, but many of them, and a growing number of them, are also serving the faculty. They're serving the parents, and even now, many of them are serving members of the community. Our first school-based health center opened up back in 1995, but under Governor DeWine's leadership, we've really seen a boom in school-based health centers, and he has been unquestionably a champion of these centers. Today, in the state of Ohio, we are now up to 138 centers across the state. And it is not just the Department of Health that is backing these centers. We're seeing the Department of Behavioral Health, the Department of Education and Workforce, Medicaid, and Development, all playing very active roles in helping us with these centers. In terms of ODH and its support for school-based health centers, that really became significant in 2022 when, with the help of what were then federal COVID relief funds, we were able to begin investing in these as a way of trying to make sure in that very difficult time we were getting needed healthcare services to kids who were facing real challenges in getting that healthcare. Since then, we've kept that initial momentum going with funding that has been very generously provided by the state legislature. $15 million in the 24-25 state budget, and in our most recent 26-27 budget, we're very grateful for that to have gone up to $20 million. Now, so far, we've been able to help support 49 school districts across 27 counties. Now, obviously, some of those school districts have multiple school-based health centers. MetroHealth is one of those partners, and we're really proud to be able to keep working with them. Now, from your perspective, Dr. Meier, how do these school-based health centers, I just said, well, they're a fairly typical primary care clinic right in a school, but as someone who, is very involved in them every day, how do they differ from a traditional clinic? What kinds of services are students using the most? And tell me a little bit about what you may be encountering in terms of people beginning to utilize these in communities beyond just the students.
Yeah, so, as you mentioned, these really are spaces where we're capturing those kids who just aren't accessing services in other spaces. So, what we see in our clinics are that, we're seeing kids who have kind of missed out, right, on primary care services. So we're catching kids up on vaccinations, but we're also treating some of those kind of common medical conditions that we know can affect attendance, but we also know that we sort of have a long way to go to make sure that we're really reaching the kids who need us to help control that. And particularly, we're seeing a lot of kids with asthma, and we're really helping them manage their asthma so that, we can just make sure that we're getting them the care that they need so that they can get, like you said, back to school, back to better health, back to engaging in their education. And what we're finding is that if we can really partner, oftentimes schools know, who really needs services. And so if we're partnering with schools, we can really, target the services that are needed, so that we're just offering those kind of services that are needed in the community that we know are going to support kids in their educational journey as well. So we really find our schools to be such important partners at identifying for us who are the kids who really need us there, and how can we be there for those kids.
One of the things that I'm hearing when I go around the state over and over and over again is that what the school-based health center is doing is, in large part, helping to keep a kid in school. That if they can get to a doctor outside of school, once they leave, that's pretty much disrupted the day. And we're seeing all kinds of data that are showing that, well, we are clearly saving classroom time. But I think people may not realize just how much of an interference basic care for asthma or for diabetes or a variety of other not uncommon conditions in kids how much of an interference that can pose to just their ability to learn. If you're sitting in a classroom and you're having trouble breathing, you're probably not paying a whole lot of attention to what's going on because you're struggling to breathe. Can you share a little bit about some of what you've encountered in terms of the difference maker that the school-based health center that you're a part of, it might be making? Not, don't. Of course, we wouldn't want to talk about a specific student, but just generally, how are you seeing that play out?
Yeah, absolutely. And, we've had students come back to us after graduating and say, if it wasn't for the school-based health program, I wouldn't have graduated. You guys were there for me in a really difficult time. I don't know if I would have made it through. And I think that those kind of stories are so powerful when we hear, from the kids and from parents. I mean, being able to, trust that your child, if they're, they had an asthma attack in school, they can come down the hall. If they, one of the things that we do is work very closely with our school nurses, and our school nurses say, if you guys weren't here, I wouldn't have the orders I need to get the students, the medications that they need. So I think we really provide that level of support. And what you were talking about earlier in terms of not just for students, but as you said, our clinics are open for school staff too. And, our educational staff are really, true public health warriors. I mean, we know that education and health, and they're so interconnected and so highly correlated. And so our educators are so important in providing such an important resource to our community, and keeping them healthy is so important too. So being able to provide those kind of on-site services, for our educators really makes a difference. And sometimes that just means, helping them manage their hypertension or diabetes. But sometimes, we're really, managing some life-altering diagnoses and making sure they're getting the care they need, and then, supporting them through recovery, and then getting back, back into health and caring and being back, becoming educators again, and being able to support their families. So, I think it's just providing that care right there in the community where people need it, when they need it. We're there for them.
Yeah, and something else that I've seen, it was just at an opening of a new school-based health center in a rural community here in Ohio. And they shared with me as I was taking a tour how exciting it has been for them to also be a resource in their community to the community. They actually have a separate entry for members of the community who may want to come in. Sometimes it's the parents. Sometimes, though, it's folks who just don't have that primary care point of contact. And so they're able to, because of their setup, safely take care of members of the community and the students within one facility. So that's sort of an exciting development, and really points to how important it can be for a community to have a school-based health center. Schools are that trusted center of so many communities. It's a place people know well. They may have gone there themselves. Their children may go there. And usually schools are located near where people live, right? So very exciting development. We're really seeing this expand and evolve in a nice way. So looking forward, of course, Ohio is not just focused on opening new centers. We're working with existing centers to help them expand, especially expand toward offering additional services. We have some that offer behavioral health, others that offer dental and vision care. And that's been very, very exciting to see. One new initiative, parenthetically, that we're also very excited about, not strictly related to school-based health centers, but to schools, is Ohio C, which we're going to be launching early in the new year, which will provide free follow-up eye exams and glasses K through 3 in 15 counties in Ohio that right now have the highest need based on a number of factors, including just their volume of kids who are failing vision screenings and not getting those follow-up exams. So that's also an exciting way that we're working with schools to improve healthcare in communities. Dr. Meier, what do you see on the horizon, either for school-based health centers generally or even for the MetroHealth sponsored school-based health centers? And do you imagine that we could get to a point where school-based health centers were pretty common in schools in Ohio?
Gosh, well, I do think that that would be absolutely wonderful. I think, I'm a family doc, so I would hope that every family, really has that regular source of care in that place where they have long-standing connections and feel seen and heard and valued and trusted, and they can really use that as a source to access, what's a wonderfully, we have some of the best tertiary cares in the world, obviously in this country, particularly here in Cleveland, where our specialty in tertiary care is absolutely phenomenal. But often people really struggle kind of accessing that care, and so having that point of contact that really can be your champion to make sure that you're getting access to the best healthcare that we have to offer. And I think every child should have access to that. And these school-based health centers really can be, depending on the needs in the community, a wonderful way for people to have that point of contact. So I think it really depends on the needs of the community. But when we talk to our educational partners and they identify, that there are kids in that kind of pocket of the community that are missing out on healthcare services, I really think that's where school-based health centers can be successful.
So what role then do you think that parents and community leaders in communities that may be fortunate enough right now to have a school-based health center, what do you think they can do to help that center really blossom and thrive and bring everything that it's capable of bringing to their community?
Well, this is such a great question. And I think it's really about that partnership and really listening, to our educational partners and to our community partners and hearing, what are the needs in the community and what services that do we have that we can kind of bring to bear in our school-based health centers. Our school-based health centers, through our national alliance, we really do have competencies for our school-based health centers. So we have kind of a roadmap in terms of kind of sort of expectations around, access and student-focused care and quality care and types of partnerships and, coordination and sustainability. But what we don't have are sort of evidence-based guidelines for implementation. And that's something that I am very interested in and gets right to your question, right? Like, how are we operating our school-based health centers so that we can ensure that the services that we are offering meet the needs in the community so that we can be successful. And I think that's pretty complicated. Those are sort of those complex partnerships. But once we get those partnerships up and running, and we really, have shared values, and we have, shared missions, and we really focus on providing those services to meet that need, I think that's where we're really going to be successful.
So what's next for MetroHealth? Do you have any plans for new clinics, for changes to the clinics you're currently operating, any new partnerships or innovations? What can folks who know your work and your centers expect in the near future?
Well, I mean, as you were mentioning, we just had, a very dramatic expansion, and we're so grateful for the work that you've been doing at ODH, and how we've been able to expand our services because of that funding and opening our new clinics. And so we know in our clinics, we really still have a lot of work to do to close those gaps, to really focus on getting those students who've missed out on vaccinations and regular checkups. And so our community health workers and our population health nurses are really busy working with our schools and reaching out to those families just to make sure that every child has access to that quality health care. But some of the things that I'm really excited about is our youth advisory councils. So, and we also have peer-to-peer programming, but really hearing from our youth. Our young people are really keeping us on our toes and making sure that we're staying accountable to them and their needs and their concerns. And so we're so grateful for their collaboration and engagement, and their voice is really invaluable to how we run our program. So we're really looking forward to expanding our youth advisory councils and really working with our youth to make sure that we're providing just the services that they need.
Well, Dr. Meier, it has been a real pleasure talking to you, especially about this important topic. And I'm really grateful for all the incredible work you and your team are doing there at MetroHealth. So thank you for doing this today.
Well, thank you so much for highlighting. This is such a wonderful resource in our communities, and really a way for us to help our children thrive.
Well, thank you again. And to our listeners, you can catch all of our episodes on the Media Center page at odh.ohio.gov/media-center, and on streaming platforms that include Spotify and Amazon Music. Thanks for listening, and we'll see you next time on Healthy Perspectives.